Welcome back to the Truth About Utilization Management, what every nurse needs to know, presented by Healthcare Nurses Network and Nurses Link Up. We know technology is everywhere in healthcare, especially the EHR. But is your tech actually helping you with utilization management, or just adding to the clicks and confusion? In Episode 8, we're exploring best utilization management technology for nurses, based on Dr. Nicolas Abella's 8th article. Too often, generic systems lead to alert fatigue and information silos, hindering proactive care. Dr. Abella argues that the key lies in integration and using technology strategically. Get ready to move beyond the basic EHR. James and Emily will discuss Dr. Abella's insights on specific tools, from clinical decision support and real-time dashboards to automation and predictive analytics, that can streamline your workflow, break down communication barriers, and empower you with data-driven insights for better utilization management. Here are your hosts, James Carter and Emily Ramirez.
Welcome back to the Healthcare Nurses Network. We're all about bringing you the strategies and real-world solutions you need to really shine in your nursing career.
And let's be honest, sometimes that means tackling the tough stuff, like how to make technology actually work for you, not against you.
Right. Today, we're going deep on how technology, used the right way, can be a total game changer for proactive utilization management. We're talking moving beyond just those basic EHRs, those electronic health records, and really unlocking a whole new level of efficiency and ultimately better patient care.
I think we can all relate to that feeling of being stuck in a click-through nightmare with those generic EHR systems, right? And that's exactly what we're tackling today.
We're really excited to be digging into this. And a lot of what we're talking about today comes from Dr. Nicolas Abella's article, Best Utilization Management Technology for Nurses. It's all about EHR integration, workflow solutions, and he has some incredible insights. Plus, we're bringing in a ton of research that backs all this up to give you actionable knowledge, things you can actually put into practice, so you can not just survive, but really thrive in your role.
That's the goal, isn't it? Thriving, not just surviving. And for many nurses out there, the reality of technology in healthcare right now is, well, let's be honest, it's often more of a burden than a benefit.
It really is. And a lot of that comes down to those generic EHR systems that so many of us are stuck with. Dr. Abella gets into this in his article, how they just aren't designed to really support that proactive approach to utilization management that we all strive for. I mean, think about alert fatigue. I'm sure you've all experienced this. It can be overwhelming.
Absolutely. One study, and this was Rose back in 2018, found that nurses can get hit with more than 150 alerts per shift. And those are just clinical alerts. Imagine all the other notifications piling on top of that.
Wow, 150. No wonder it's hard to even see the critical ones when you're getting bombarded like that. And then on top of that, you have the issue of information silos, which Shanmugam wrote about more recently in 2024. You have patient details scattered across different systems. It's like a puzzle you have to constantly piece together.
It's exhausting, honestly. And then you factor in all the manual data entry. So much time wasted on tasks that could and should be automated. And this really ties into the problem of a lack of real-time insights. Giardino and Wadwa, they had a great paper in 2023 about this. We're often forced to react to situations rather than getting ahead of them.
Exactly. It's frustrating. But here's the good news, all right. There's a better way. And this is where things get really exciting. We need to start thinking about utilization management as an integrated ecosystem. And this is really the heart of what Dr. Abella is advocating for. Seamless data flow between all the systems we use every day.
That's the key, isn't it? Seamless data flow. It means having the right information at your fingertips right when you need it, and in a way that actually makes sense.
It's about moving beyond this idea that the EHR is the be-all, end-all, the single source of truth. Because let's face it, crucial information lives in other systems too, like case management, billing. It's all connected.
It is. And think about how powerful this integrated advantage could be for every nurse, every role. Let's start with the bedside nurse. Imagine, instead of juggling multiple systems or playing phone tag just to get basic information, you could access everything you need about a patient's insurance, their pre-authorization status, the medical necessity criteria, all right there in the EHR. Think of how much smoother care planning would be.
Oh, absolutely. And then take a nurse leader. Now they can have a real-time dashboard that pulls data from both the EHR and the case management system. It's like having a bird's eye view of their entire unit. They can see those key utilization management metrics, spot trends early on, and intervene proactively.
And at the CNO level, it's all about championing this vision of a fully interconnected system, advocating for the IT infrastructure that makes all of this possible. Because at the end of the day, this isn't about fancy technology for the sake of it. It's about creating a healthcare environment that actually supports high quality, efficient care. And that starts with the way our systems talk to each other.
Absolutely. Now let's talk about a specific technology that I think has the potential to be truly transformative. Clinical Decision Support Systems, or CDSS for short. We've all probably seen those basic alerts that pop up in our EHRs, but CDSS is so much more than that.
It is. And a 2017 paper by Marshall and others, they dove deep into the possibilities of CDSS. It's about leveraging evidence-based recommendations, delivering alerts and insights at the point of care. It helps us make more informed decisions about medical necessity and ensuring each patient is getting the appropriate level of care.
You know, it's not just about blindly following alerts. It's about having that extra layer of intelligence, that evidence-backed guidance to support our professional judgment and decision-making.
Exactly. Picture this. You're a bedside nurse and you get an alert suggesting that, based on the latest guidelines, a patient might be ready for a lower level of care. It prompts you to take a closer look, maybe have a conversation with the care team, and ultimately make a more informed decision. It's about having that support system in place.
I love that. And for nurse leaders, CDSS can be huge for ensuring consistency across the team. Everyone's working from the same evidence-based playbook, which leads to better outcomes. And for CNOs, investing in a strong CDSS. It's a strategic move that shows a commitment to both clinical excellence and responsible resource use.
Now, speaking of seeing the big picture, let's talk about real-time dashboards. And this is where the real-time dashboard revolution, a term coined by Tony Healthcare in 2023, comes into play. It's all about having that instant visibility into how utilization management is actually working. Not static reports that are outdated the minute they're printed, but dynamic visual tools that give you an up-to-the-minute snapshot of what's happening.
It's so powerful. Imagine a bedside nurse being able to see a patient's length of stay right there on a dashboard compared to what's typically expected for their condition. That can spark those crucial conversations about discharge planning way earlier. It just makes everything flow so much more smoothly.
It does, and for nurse leaders, dashboards offer that panoramic view of all potential discharges. It helps them anticipate staffing needs, identify any potential bottlenecks, and ensure those smooth transitions of care that we're all aiming for.
And for the CNO, a hospital-wide, real-time dashboard is a game changer. It highlights what's working well so those best practices can be shared, and it pinpoints areas for improvement. It's all about data-driven decision-making at the highest level.
You know, we can't talk about leveraging technology without talking about communication and collaboration. That's the foundation of good patient care and efficient utilization management, too. And Buljak-Samardzik and their colleagues, they really highlighted this back in 2020. They did some great work looking at how technology can break down those communication barriers between nurses, physicians, case managers, everyone involved in a patient's care.
Because when communication breaks down, that's when things fall through the cracks. And simple tools can make a huge difference. Think about a bedside nurse who can use secure messaging to quickly connect with a case manager about a potential discharge barrier. No more phone tag, no more delays.
Exactly. And nurse leaders can use technology to streamline those daily interdisciplinary check-ins. It keeps everyone on the same page, and it means we can address utilization management needs as they arise.
I love that. And for CNOs, investing in a telehealth platform can be incredibly impactful, especially for patients in remote areas or those with complex needs. It makes it easier to have those virtual consults, which means better collaboration and access to specialized expertise.
Now, let's shift gears a little and talk about the automation advantage. We all know how much time gets eaten up by manual tasks, and technology offers some amazing opportunities to automate those routine processes. That frees us up to focus on what we're all here for: direct patient care.
Right, and it's about working smarter, not harder. Think about an EHR that can automatically generate referrals based on preset criteria. No more manual entries, no more missed referrals. And nurse leaders can use those robust reporting capabilities in EHRs to automate a lot of that data analysis they need for performance monitoring and quality improvement. It saves so much time and effort.
And for the CNO, advocating for those automated processes across the whole organization, that can lead to huge gains in efficiency and cost savings.
Now, let's talk about something that I think is incredibly exciting: predictive analytics. And this isn't about seeing the future. It's about using data to identify patients who might be at higher risk for certain outcomes. And then We can intervene proactively to change that trajectory.
A 2020 paper by Chen and others really highlighted the potential of this. It's all about using data to our advantage.
It is. Imagine a system that can flag patients at high risk for readmission based on their history, their diagnoses, everything we know about them. That gives the bedside nurse the chance to step in with targeted education, support, maybe even connect them with resources they might need after they leave the hospital.
And nurse leaders can use predictive analytics to guide their rounds. It allows them to focus their attention and resources where they're needed most.
And at the CNO level, predictive analytics can be a game changer for managing things like prolonged lengths of stay. By identifying those patients early on, the care team can step in, figure out what's going on, and come up with a plan to optimize their care and resource use.
You know, we've covered a lot of ground today, but we don't want to just leave you with information overload. We want to give you the tools you need to actually put this into practice. So we've put together a free resource with real-world examples of how all of this is being used in different settings. If you want a copy, just email us at nurselinkup@healthcarenurses.net and put technology case studies in the subject line. We'll get that sent right over to you.
And before you go out and invest in any new technology, it's so important to really assess your organization's needs. What are the pain points your nurses are facing? What are the specific challenges you're trying to solve?
It's about finding the right tools for the job, and that might mean starting with some good old-fashioned workflow assessments, as Boljak-Semerdzik and their colleagues talked about in their 2020 research. Figure out where the bottlenecks are, where the opportunities for improvement lie.
We have a free utilization management technology needs assessment to help you with that. It'll walk you through the process of identifying your priorities and figuring out which solutions will have the biggest impact. Just email us at nurseslinkup@healthcarenurses.net and put technology needs assessment in the subject line. We're happy to share it with you.
So let's get into some of the specifics. What are the tools that should be in every nurse's tech toolkit for proactive utilization management? Let's start with enhanced EHR functionalities. We're talking about customizable documentation templates to streamline that whole process of documenting medical necessity. Integrated clinical pathways, like Avidia talked about in 2022, can provide that clear roadmap for care delivery, ensuring everyone's following best practices. Real-time alerts and reminders, those can be so helpful for prompting timely interventions and preventing issues before they even arise. And then the ability to automatically pull data for reports, huge time saver.
And of course, we can't forget about CDSS. It's such a cornerstone of this toolkit. Having those evidence-based guidelines integrated right into your workflow, getting those real-time medical necessity alerts, and even personalized recommendations for each patient.
And then you have the whole world of predictive analytics and AI, artificial intelligence. We have risk stratification algorithms, and these can really help us identify patients who might be at higher risk for longer stays, readmissions, even claim denials. And then there are early warning systems that can constantly monitor patient data, alerting us to subtle signs of potential problems so we can intervene early. And then there's natural language processing, or NLP, which is basically teaching computers to understand and extract meaning from all that unstructured data in our clinical notes and documentation.
Communication and collaboration platforms are essential too. Secure messaging to keep those lines of communication open between the entire care team, shared care plans so everyone's working from the same information, and telehealth integration, which just opens up so many possibilities for virtual consults and reaching patients who might not have easy access to care.
And mobile technology is changing the game at every level. For bedside nurses, it means having access to crucial information right at your fingertips. Nurse leaders can use it for on-the-go training and communication. And for CNOs, it's about strategically supporting the use of mobile devices to empower the entire nursing staff.
And we can't forget about robotics, which might seem futuristic, but it's really starting to make its way into healthcare. CNOs are looking at how robots can help with things like delivering supplies and medications, freeing up nurses for that all-important direct patient care.
Now, we'd be remiss if we didn't talk about the challenges, right? There are always hurdles when it comes to adopting new technology. One of the biggest ones is that our IT departments are often already stretched thin. The key here is to partner with IT early on, make sure they understand your needs and the potential benefits, and work together to find solutions that will work for everyone.
And we can't forget about resistance to change. It's natural, especially when it comes to technology that impacts our daily workflows. But a big part of overcoming that resistance is providing comprehensive training and support. making sure nurses feel comfortable and confident using these new tools.
And that's where emphasizing the benefits comes in. Show nurses how this will make their jobs easier, reduce that administrative burden, and ultimately lead to better patient care. And involving nurses in the selection and implementation process can make a huge difference. When they feel like they're part of the solution, they're much more likely to embrace it.
And of course, there's always the budget issue. But it's important to remember that you don't have to do everything at once. Maybe start small, implement a solution in a high-impact area, and show the value. That can pave the way for bigger investments down the road.
And this is where nurses need to step up and be the champions for change. We're the ones on the front lines, we see the challenges, and we know what will make a difference. So let's use our voices to advocate for the technology that will truly empower us to provide the best possible care.
Because at the end of the day, that's what this is all about. Moving away from reactive utilization management and embracing a more proactive, data-driven approach. And that starts with us, with nurses taking the lead.
It's about creating a healthcare system that's more efficient, more sustainable, and ultimately more rewarding for everyone involved.
This has been such an important conversation, and we want to make sure you have all the resources you need to keep learning and growing. For more information, for those direct links to the resources we mentioned, visit healthcarenurses.net.
So let's recap. Technology, when it's implemented strategically and with a focus on integration, has the power to truly transform the way we approach utilization management. It's about streamlining our workflows, getting those real-time insights, enhancing communication and collaboration, and automating those tasks that take us away from our patients. And it all starts with moving beyond those basic EHRs.
Now, here's something to think about. How could even just one of these technologies change your day-to-day work? What if you could move from reacting to problems to anticipating them? How would that change the care you're able to provide?
We encourage you to keep exploring these ideas. Connect with other nurses who are passionate about this. Visit healthcarenurses.net. There's a whole community of nurses there ready to share and learn together.
Thank you so much for joining us today on the Healthcare Nurses Network podcast.